In terms of overall heart health, blood pressure and high cholesterol become very important. The definition of hypertension is a blood pressure that is over 120/80. We would like to see our patients with blood pressures under 120/80. Patients who have blood pressures that are greater than 120 for their systolic number and greater than 80, we would call pre-hypertension. Once they hit above 140 for their top number or their systolic number, and their diastolic number above 90, we start getting concerned about hypertension. We would have pharmacological ways of treating with this, but first and foremost, we would start non-pharmacological types of treatments. We would start dieting, we would start exercise, we would start low-salt diets and things like that to help. And if we measure blood pressures 2 or 3 times over the next couple of weeks and they remain elevated, even despite dieting and exercise and a low-salt diet, then we start thinking about adding medical therapy. In terms of cholesterol numbers, there are specific guidelines that we'd like to follow. If a patient has heart disease, if they've had an infarct or a stent or a myocardial infarction, or they've had a stroke or peripheral vascular disease, we would like to see their LDL cholesterol under 70, and we would push different types of therapy to get there. HDL is also a very important cholesterol value that we like to know all the time on our patients. We'd like to see our HDL cholesterols over 40, and basically the higher the better for that number. Women should have their blood pressure and lipids tested. In general, if they've got heart disease, probably every 6 months to a year. If they're taking pharmacologic therapy, at least every 6 months or at least twice a year would be very important. We would like to use our guidelines to help us readjust our medicines and more fine-tune our medicines in terms of the cardiovascular benefits of the pharmacological treatment that we do for our patients.